So good afternoon, everybody. I'm James Hudspeth. I'm one of the hospitalist medical directors. I'm just giving a quick update from how we're doing inside the hospital these days. I think there's been a lot of attention paid to the fact that we have a number of models that have been developed both outside of BMC and inside of BMC to help us get an idea of what exactly we're going to be looking at as we head towards the surge of cases in Massachusetts. And these models have been very helpful for us in terms of the organization that we're doing in the hospital, because it lets us get a sense of how many patients we have to be able to take and make sure we've built a structure that is appropriate for them. So from the perspective of the inpatient physician side of things, inpatient provider side of things, we've done a lot of work both in terms of staffing and reorganization to get set up to take the maximum number of patients that we might see in the event of a surge. And in particular, we're trying to make sure we preserve the quality of care for patients, but that we have a system that we can kind of accordion outward if we need to make sure we get the number of people covered that we would want. In terms of some of the reorganization we've had to do for this has meant that we've closed down a lot of the inpatient teams that we used to have and shifted some of their personnel to focus on taking care of COVID positive or COVID suspected patients. This has involved a lot of reorganization for us and for our colleagues in nursing because our workflows are very different. And in point of fact, like just the daily care of the patients in terms of doffing PPE and trying to think proactively about ways to minimize the number of room entries has really been an interesting challenge and one we've made a lot of progress on. Some of the biggest things we've done in terms of staffing are using some physicians from other spaces outside the hospital of normal. So we have, for instance, some of our primary care doctors who usually just do a few weeks in the hospital doing longer stints with us to help provide support from the attending and faculty perspective. We also have a lot of residents from non-medicine residencies who are doing 1 week periods with us to help assist our residents with their work. And of course, our own residents have done a huge amount of labor to take care of the COVID patients and are now dedicating a significant portion of their overall time to working with those patients. So 1 second, I'm just gonna switch my camera around and I wanna show people a brief series of the places that we are working. So this is one of our COVID rooms, or rooms with providers who are working on COVID patients. This is a set of our nurse practitioners and physician's assistants who are working hard to admit patients, and they take on the admitting burden to kind of assist our providers who are taking care of patients who are already in the hospital. One of the other things that we can note is just in terms of the reorganization of space, that room usually is just a small consult room. And then down here at the other end of the hallway, we can see that we've repurposed one of the family meeting rooms to be a new physician workroom for the moment, both allowing us to have more teams added to the overall hospital, and then also allowing us to have enough space so our providers can space themselves out and work at an appropriate distance so we reduce the risk of infection. And that's that room down there. All right, I think overall, my biggest takeaway from the last few weeks has been that we've really done a pretty successful job as an organization in terms of tackling a really big challenge. And I think while we still have work to do in terms of improving our systems, we've made a lot of headway and really have a pretty strong structure at this point that I am confident can actually take whatever we're going to deal with in terms of the surge. I think we are well prepared for it.